Good morning. It is January 11th, and this is the Senate Health and Welfare Committee meeting. Today, we're going to be looking at a bill that was passed by the House on relating to child and family advocate issues, or the child and family advocate or child advocate bill. Let's put it that way. And then after we've looked at that bill, we'll go through a report that comes to us from the Child Protection Oversight Committee, and our committee will be able to have a discussion about our next steps with this bill. That's all we have scheduled for today, which is a good thing. Nolan's going to talk with us a little bit about fiscal note related to the issues that we're looking at. So we have key sponsors and reporters here from the House. Representative Dan Noyes and Representative Kelly Pahala, thank you both for being here. Why don't you two present the bill and let us know what's there just briefly. Katie obviously will have an opportunity to go through the bill with us, but we want to hear from you what your experience was in the House and the things that you have discovered.
Sure. Thank you, Madam Chair. So I'll give an overview of some of our thoughts that we had. And so H265 proposes an independent office within state government whose job it is to report on the systems to provide services to over 1,000 children and youth who are currently in state custody. When the bill passed the House last year, there were 67 kids who were housed in programs that spanned 8 states. My introduction to this concept came from a young man who grew up in the custody of the state. After many foster placements and 10 residential placements, including Laraway and Beckett, he recently transitioned to independence without much of a safety net. Above the odds, he currently works full-time and serves as a volunteer firefighter in Wolcott and is working towards his EMT certification. I'd like to add that every time I see him, he asked me about this bill and continues to advocate for those navigating the same system he did. One cannot underestimate the massive responsibility that DCF is tasked with. The trauma involved in separating families is real. It's our responsibility that it's done with care and compassion for the children, parents, and all those involved. It is our belief that the investments in systemic change will improve outcomes for children and youth in our child welfare system and juvenile justice systems. This bill was designed to be non-adversarial and to support DCF in ensuring children and families are better off for their efforts. There's no doubt this job will not be an easy one. The complexities and magnitude of our child protection system will take time to understand and decipher. A skilled advocate will collaborate with our existing systems in critical ways at a much needed time. Creating the Office of the Child, Youth, and Family Advocate I think is the right move for Vermont. This office will listen and ask questions both internally and externally of state government. This is important because DCF is bound by confidentiality, and therefore it's currently no one outside of our systems who is able to see the full picture of our children and youth in care. The advocate will work in collaboration with state agencies to make recommendations and track successful transition of youth in state custody to adulthood. They will identify trends and share them in productive solutions in a focused way. They will interpret and inform best practices, and they will report to DCF, the governor, and to this body on how we can improve outcomes in our child welfare system. What does this office look like? Our child welfare system will offer the right intervention for the right children at the right time. There'll be less turnover for foster families and DCF staff. Families will look to DCF for help when they are in need of help. Families will be heard when reporting abuse and neglect. People will trust our systems, and we will hear very different stories from our constituents in the years ahead. There's 20 other states with advocates. We're the last state in New England to establish this office. We rely on a citizen legislature to provide oversight of complex and often politically charged system of care. We hear stories from families, foster parents, state employees, and youth with lived experience, and sometimes we have no ability to help. So thank you for listening to me, and I'd be glad to answer any questions. Thank you.
Thank you. Representative Pahala, did you want to add any comments or information? And Representative Noyes, thank you for introducing the bill and then for your advocacy in this area. I know you've been working very hard for this across the state. Thank you.
Thank you.
So, yeah, Representative Pahala.
Yeah, thank you for having us this morning. I would just add that this bill came up in the context of the Child Protection Oversight's work several times since the legislature adjourned, and which is part of why it's here this morning. And one of the contexts involved the Kern Hatton and the fact that it is seeming to fall not under anyone's regulation in terms of their residential program. And in that situation, who do children and families turn to if there's no one overseeing a program? And an office like this would provide a place for children to be able to get some assistance that is outside of the state system. So it provides a neutral party to look at our child protective system and the juvenile justice system, and as a system, find places where we can improve. So I'm trying to think of there was another spot that it kept coming up, and that was when we were talking about the juvenile justice system and children that were in the custody of the state because of offenses. And again, if there are complaints and you're reporting them to the same agency that is overseeing the care that you are getting, it's hard to feel like you're being heard and you're being served and being treated as a humane or in a humane way by the system. And so this is a means of creating something that can look at the entire system and point us to improvements. And I think that it's timely for several reasons. And the House chose to create something that is within state government so that it can work with multiple branches of government, the judicial system, child protection, and have access to information that gives a better, clearer picture of how the systems work together to serve children and families. So that's how it came up in child protection oversight. And thank you so much for listening to us this morning and for taking a look at this bill.
Oh, well, thank you. And thank you both. I have two questions, actually. One is, where is the advocate placed in state government? I know we'll see this when we go through the bill, but just to hear the two of you, maybe your comments about where it's placed.
So we did have a lot of discussion, and we worked with having it in the administration. We ended up just putting it in state government. There are a number of other positions that are just in state government. The Office of the Racial Equity, I believe, is also just, it's not housed in any part of state government, but it is in state government. Okay. And I'm sure you'll hear more from Katie about that in the bill. But we did talk quite a bit about where it should be. We also looked at a lot of other states. Some states have it in judiciary, some have it within the administration, governor's office, but we kind of wanted it within state government, so they had access to state government, but not as part of it, not as part of a department, if you will.
Okay. Can I ask my next, Senator Cummings, go ahead. If you're probably continuing on this line, and I'll come back to my other question.
No, I was just wondering, did this get through appropriations in the House?
Yes, this bill
And
went to,
where is the money coming from?
Okay, so do you want to, they can answer the question. I'm not telling they
Okay.
can't, but I think Nolan's going to give us a fiscal note.
Okay,
I saw relief.
I can tell you what committees it went to. It did go to Judiciary, Government Ops, Appropriations, and Human Services.
Wow, okay. So it took quite a tour. Go ahead, Senator Cummings.
yeah. Did you have testimony from the social workers that do this work? I was on the I should say, I was a foster parent, not in Vermont. Found out that our teenager had failure to attach syndrome and was the foster child from hell. I worked with foster parents here and have been with a young woman I worked with as she, I would say, got somewhat unceremoniously dropped at the age of 18. And I was on the child study committee. Plus I've worked with challenged parents. So I've got some familiarity. When we did I forget, it was when the two children in state custody died and we did the study. What we found out is during the recession, we cut all our middle management personnel, which were the experienced supervisors, and that we did not have enough people to do the work, that the people we had do not require a degree in social work. We train them, but we didn't have people to train and supervise them. And I guess I'm a money chair. If we're going to put money into it, did you hear, from the people doing the work on the ground, what their issues are, so we can decide what's the best thing to do?
You're talking about the
did.
DCF workers who
The
have
DCF
oversight
workers,
over the
and
kids.
I also understand that everybody supports the governor's budget, so it's very difficult to get a straight answer.
We talked to a lot of people, and I was just looking for the witness list from our committee assistants from when we presented the bill. I will track it down and send it to you.
Okay.
I'll send it to Aaron so that you can take a look at it. But we took testimony from a pretty wide group of people, so I will send that along.
Okay, thank you.
Okay, and I will say also that last session, boy, the time just is not there anymore with the pandemic. You don't know where you are in life. But
I know.
during the last session, the Child Protection Oversight Committee did take significant testimony about this position, and including hearing from DCF. So
Okay.
we're going to go back and see who offered what testimony there a couple of years ago, but it's still relevant. I guess my question, did you want to add anything, Representative Pahala?
Just quickly, one of the things Child Protection heard was a report that looked statewide at regions of the state and where there were trends that differed from one another in terms of how many children were separated from their families, and
Yes.
taking a look at within the system where different areas might be treating the process differently. And so in my mind, this office is that would be something that they would be doing on a regular basis, seeing where the law was being applied differently, and where there might be trends where separation was more prevalent, or providing more support so children can stay with their families was more prevalent, and making that more evenly applied and more justly applied statewide. And, you know, if this office was in place, we wouldn't need just studies here and there to take a look at that. We would have someone tracking that information and making recommendations for how it can be done more fairly everywhere. So anyway, that was.
All right, thank you. I have one last question, probably not the last as we go forward, but just briefly, you brought up the issue of the Kern Hatton residential program, and there are other residential programs that if they don't have state licensure from DCF and they're not under the AOE, that there's no oversight for the kids. Is there language in the bill that lends itself to that type of work for oversight of residential facilities? Did you guys talk about that and put it in?
When we recently just read through the bill again, I was keeping that in mind as I was listening, and we didn't specifically spell that out as a circumstance, but I think that it can cover that, and if there's a need to be more explicit and make sure that that is something that is in the bill, I think as you walk through the bill with Katie, you'll be able to spot where, you know, that could get built in. But it was a big enough umbrella that it seemed like it would be in there, but there's certainly no harm in adding some suspenders to the belt.
Thank you. Thanks for that. Okay, committee, other questions? So we have the financial question that we need to answer, and we'll get Nolan to do that with us after we've walked through the bill. Any other questions about for the House members who are here? Senator Cummings?
This is a one-person office?
To start, it would be a one-person office. You'll see that the bill kind of transitions this individual into the job responsibilities so that it's not opening a floodgate of so many different things that are encompassed within this. So, but yes, starts off one.
I
and
was
then it can
I was
expand.
listening to the scope of work and seeing a new division of state government. Okay.
So,
They are,
you know, let
able
me
to
ask
hire
this.
a deputy.
I'm sorry, go ahead,
Sorry,
Representative.
they are able to hire a deputy. So it's
Deputy,
two.
two deputies.
No, just, well, one deputy
One
to start
deputy.
off, but it would be a two-person.
Office. Is that, okay, no clerical support, no. Okay,
So, yeah, so and you know, we have heard in the past on the Child Protection Oversight Committee from the New Hampshire child advocate. I'm not sure that this is modeled directly after New Hampshire, but we can bring other folks in to testify to get clarity about how many people and what the cost has become over time. You said we're the last state in New England that doesn't have this?
Yes. And we did hear from the New Hampshire Office of the Child Advocate.
You did, okay. And then 28 states already have this? Yes, I see you, okay. All right, well, we
27.
have some ground to cover to get all the answers to the questions that we have and some that we don't have yet, but we will. Okay, thank you both. You're welcome to stay while Katie goes through it. And please do keep us posted as we are working on the bill. If you have some insights that you think are important, let us know. Okay, Katie.
Good morning.
Morning.
Katie McGlynn, Office of Legislative Counsel. I will pull up the bill.
All right.
Okay, H265, is that showing up on your screens?
Yes, ma'am.
Great. So this is obviously the version that passed the House, and we're creating a new chapter here, the Office of the Child, Youth, and Family Advocate. So first, we have a definition section. It's fairly straightforward, so I'm going to kind of skip past that section in the interest of time. And then we move to the section of the bill 3202. And this section really frames what this office is responsible for, the first paragraph especially, and then we go into a list of separate individual responsibilities that the office will take on. But just in terms of kind of framing why this office is being created, this first paragraph is pretty informative. For the purpose of advancing the interest and welfare of Vermont's children and youths receiving services from the department in a manner that addresses racial and social equity, including providing transparent and impartial oversight of the child protection and juvenile justice systems, and promoting reforms necessary to better serve Vermont's children, youths, and families. And then the question about where's this office located? The language is that the office is to act independently of any state agency in the performance of its duties. So that language is at the top of page 2.
So can I ask a question?
Please.
Committee, do you want me to ask questions as we go through, or shall we hold off?
It's fine.
I don't want to, well, yeah, I'm going to ask it. So will the state have an obligation in any way to provide an office then for the child advocate?
So this is a state office, and state employees are staffing the office. So
Okay,
yes, but it's not housed within the agency of the administration or within
Right.
DCF. It sort of stands alone as its own office.
so it
yes,
could be
needs
placed
office space.
anywhere. It could be placed anywhere.
Yes. So next, subsection B, this goes into a detailed list of all the responsibilities of the office. So I think it's worthwhile to go through each of these. First, the office is responsible to work in collaboration with relevant parties to strengthen the department's services for children, youths, and families. And second, to analyze and monitor the development and implementation of federal, state, and local laws, regulations, and policies relating to children, youth, and family welfare, and recommend appropriate changes. I'm going to pause there. There is a little bit of a line that's drawn between 2 and 3 in terms of what the office's responsibilities are when the office is still getting off the ground. So there's sort of like you'll see at the end of the bill, a 6-month lag time between when the office is first established and when all of the responsibilities and duties of the office kick in. So for the first 6 months, when the office is still kind of getting its feet under it, only B1 and 2 are part of the responsibilities and duties of the office.
Okay.
And then beginning at 3, the rest of these duties kick in 6 months after the office is sort of up and running.
Thank you for that clarity. I was beginning to think this was Herculean. It is already, but I'll make it even more.
So subdivision 3, reviewing systemic issues in the department's provision of services that may exist and complaints concerning the actions of the department and any entity that provides services to children, youths, and families through funds provided by the department. Making appropriate referrals and investigating those complaints where the advocate determines that a child, youth, or family may be in need of assistance from the office. Subdivision 4, supporting children, youths, and families by
Can I
providing.
ask you a quick question there? Just don't have to answer it completely, maybe in future testimony, but how currently do these referrals take place? And so the investigation complaints of complaints, but how do referrals ordinarily take place? Is this through what?
I suppose it depends on the type of referral. What is the question that the family or youth has? I think it really depends. Is the service around foster care? Is it around some other type of benefit. I mean, this talks about any service that a family receives through the department. So it's broad enough that this could encompass questions about CCFAP. So I think it really depends on the type of services that are in question.
Okay,
Although
Thank
I should say, I'm saying it's very broad, any service that the department renders, but the kind of framing language does talk about including impartial oversight over child protection and juvenile justice systems. So I
Right.
think we're talking about, all services provided by the department, but there is
within
clearly
the
sort of a
context, yeah,
focus,
yeah, so-
on child protection and juvenile
Okay.
justice.
got it.
So subdivision 4, providing information about recipients' rights and responsibilities related to departmental services. Subdivision 5, reviewing current systems to determine to what extent children and youths placed in custody of the department or who are receiving services under the supervision of the department receive humane and dignified treatment at all time, including consideration by the advocate as to what extent the system protects and enhances the child's or youth's personal dignity, right to privacy, and right to appropriate health care and education in accordance with state and federal law. In Subdivision 6, providing systemic information concerning child, youth, and family welfare to the public, to the governor, other state agencies, legislators, and others as necessary. Subdivision 7 is a reporting requirement. There's an annual report due to the General Assembly and Governor on December 1st of every year. And A through E specifies exactly what's in this report. So the quality of services provided, the conditions of placements for children and youths, systemic findings related to services for and assistance to children, youths, and families within the child protection and juvenile justice systems, recommendations related to improving services for children, youths, and family, and then also data disaggregated by race, ethnicity, gender, geographic location, disability status, and any other categories that the advocate deems necessary. So that is all part of the annual report that would be submitted by the office each year. Other responsibilities include addressing any challenges to accessing information or records that are necessary for carrying out the provisions of this chapter. You'll see in the language to come, there's a whole section on how the office accesses information. But to the extent there are any challenges, this directs the office to work to address those challenges.
I have a quick question, and maybe it's for the representatives. The report goes to the General Assembly and the governor. Was there any thought about sending it to specific departments or agencies? So judicial branch is separate branch of government. So did you think about that?
Actually, I don't believe we did, but it would make
Okay.
sense to do that. So
Okay. And then DCF itself, I don't know whether that was a conversation. We'll hear from folks, so we'll
yes.
sort it out. Thank you. Okay, Katie.
Okay. So the next section, we just went through all the duties of the office. The next section is about the advocate and how the advocate is selected and how the advocate can be removed from office. And also it covers that the advocate can hire a deputy. So going into each of these subsections, we have that the office is directed by an advocate. This is an individual who is to be qualified by reason of education, expertise, and experience, and who may have a professional degree in law, social work, public health, or related field. And this language specifies that the advocate is to work on a full-time basis and shall be exempt from classified service. In subsection B, we have how this individual is selected. So subdivision B1 references an oversight committee. We'll look at the oversight committee later on in the bill, but for the purposes of sort of understanding the structure of this bill, there are two committees. One is called the Oversight Commission. That's more like the steering council, the steering committee that kind of looks at the big picture of what is the mission of the office. Is the office meeting its mission? And it also is responsible for proposing different candidates to be an advocate. There's also a separate advisory council that is composed more of people with lived experience, advocates. It's more of a boots on the ground resource for the office and the advocate to seek advice from. And that advisory council is a temporary council, whereas this oversight commission that's overseeing and providing kind of mission guidance, for lack of a better phrase, to the office. That commission is ongoing. So B1 talks about the Oversight Commission, the entity that's providing kind of oversight and overseeing the mission of the whole office. And this Oversight Commission is to recommend qualified applicants for the position of advocate to the governor for consideration. Subject to confirmation by the Senate, the governor is to appoint an advocate from among the applicants recommended by the Oversight Commission, and the term is 4 years. The appointment for the advocate is to be made without regard to political affiliation and on the basis of integrity and demonstrated ability. The advocate is to hold office until reappointed or until the successor is appointed. And then subdivision 2, this is how the advocate would be removed prior to the end of their 4-year term. So the governor, with a majority vote from the Oversight Commission, can remove the advocate for cause, which includes only neglect of duty, gross misconduct, conviction of a crime, or inability to perform the responsibilities of the office. And the governor's reason for removing the advocate is to be published electronically on the website for the office itself. And also the speaker and the pro tem are to simultaneously receive notification if the advocate is voted not to finish their term. And then any vacancy is filled by the same appointment process that we've already looked at, and it will just be for the remainder of the unexpired term. Subdivision C says that the advocate shall appoint a deputy, so that's requiring the appointment of the deputy, whose duties shall be performed at the direction of the advocate. And then in subdivision D, if there's any vacancy in the position of advocate, until there's a replacement appointed, the deputy is to serve as the acting advocate. And the acting advocate is to have the full responsibilities of the advocate, the same compensation as the outgoing advocate. This next section 3207, this is the advisory council. So this is not the oversight committee that gets to weigh in on how.
I should have asked my question, but it's probably pertinent as well to the next section. And so Representative Pahala and Noyes, these are the sections I would think possibly that the GovOps went through to look at all the organizational structure and appointments process.
Yes.
Yes.
Okay, thanks. Go ahead, Katie. I'm going to interrupt. I can't.
Oh, please do. I'm
Okay.
happy to answer questions, and I'm happy to refer questions to the representatives as well. So 3204, this is the advisory council. So this is not the Oversight Commission that weighs in and gives recommendations to the governor on who would make a good advocate. This is the group of individuals who have some type of lived experience and who can provide direct advice and feedback to the office on different issues that come up. So the advocate is to appoint and convene the advisory council. It's to be composed of 9 stakeholders who have been impacted by child welfare services, provided by the Department for Children and Families. The Advisory Council's membership is to reflect the growing diversity of Vermont's children and families, including individuals who are Black, Indigenous, and persons of color, as well as with regard to socioeconomic status, geographic location, gender, sexual identity, and disability status. And members shall provide advice and guidance to the Office of the Advocate regarding the routine administration and operation of the office, including providing advice and guidance to the advocate upon request. So I think that language is really important. Routine administration and operation, and advice and guidance on request. So that really captures what this group is doing. So we have sort of some standard language. You'll note that this bill was introduced at the beginning of 2021. And because this bill is being reviewed over the 2 years of the biennium versus passed in 1 year, these dates would all have to be pushed back a year if this committee chose to move forward with this bill. So any date you're seeing on the on this House version of the bill, you could just assume that it would be 1 year later. So meetings, the advocate would call the first meeting of the Advisory Council to occur by March 15th of the first year that it's up and running. The Advisory Council would select a chair from among its members, and then the Advisory Council would cease to exist on July 1st of 2029. So not 2028, 2029. So I said this was a time limited council. So it's about, trying to do the math, it would be about 5 to 6 years that this council would be in effect, and then it would just sunset once the office itself had a few years under its belt. Next, subsection C is a confidentiality section, and seeking the advice and guidance of the council, the advocate is not to disclose to the council or any members of the council individually identifiable information about a child or youth unless the information is already known to the public. And then we have standard language about compensation, and this group would be permitted to meet not more than 12 times annually. And the payments are made out of monies appropriated to the office. So that is the Advisory Council. And then the next section, 3205, has to do with information that the department has to provide to the office in certain circumstances. So in subsection A, the department is to provide the office with a copy of all reports related to actual physical injury to children or youths in the custody of the commissioner, or a significant risk of such harm. And then secondly, the department shall provide to the office a written report within 48 hours of the fatality of a child or youth in its custody, and also the restraint or seclusion of any child or youth in its custody. So later on in the bill, we're going to see that the office, the advocate and deputy, can ask for information, but this section covers things that the office doesn't have to ask for. This information is coming automatically right to the office without a request having to be made. Okay. So next, 3206, access to information in facilities. So just to kind of help you understand the layout of this section. So subsection A sort of lays out the general rule, and then B and C are exceptions to that rule. So I think, unless I'm thinking of the next section, well, let's go through it. So the advocate and deputy advocate shall, upon request, have timely access, including the right to inspect and copy any records necessary to carry out the provisions of this chapter, including relevant records produced and held by state entities and third parties. So that's pretty broad. Upon request, timely access, the right to inspect and copy any records, as long as it's helping them carry out the provisions of the chapter, what we outlined in their duties. And then, oops, when I said that these were exceptions, I was thinking of a section further on. So the advocate and deputy advocate are allowed to communicate privately and visit with each child or youth who is in the custody of the department, but if the advocate or deputy advocate want to communicate with a child who is not in the custody of the department, they have to get the consent of a parent or guardian. So if a child is in the custody of the department, the advocate and deputy advocate don't need permission, consent to privately communicate with that child. If the child or youth is not in the custody of the commission, then consent is needed to privately communicate or visit with that child. And then with regard to facilities, access to facilities, subsection C, facilities and providers delivering services to children and youths shall permit the advocate or deputy advocate to access facilities and communicate privately and visit with children and youths with whom they provide services. So that's pretty broad.
Is that the broad language that kind of captures the residential
Yeah,
institutions?
We went back and looked at this language in light of the conversations that Joint Legislative Child Protection had this summer. And really looking at this language, facilities and providers delivering services to children and youths. This doesn't limit it to facilities that have children in the custody of the department. This is really covering all facilities and providers delivering services. So this could cover a school, anywhere that is serving children and youth. I think gives the advocate and deputy advocate pretty wide access.
Okay,
So
thank you. Yep.
Mhm. So this next section, 3207, cooperation of state agencies. This is sort of the inverse of what we've said. So far we've said that the advocate and deputy advocate can ask for all of this information as long as it's reasonable. 3207 says state agencies, as long as the requests are reasonable, you have to comply with these requests for information and assistance. And then 3208, this is the confidentiality section, and this is what I was thinking about previously in terms of the structure. So subsection A lays out the rules of confidentiality for the office, and then there are some exceptions in subsection B and C. So first, in subsection A, the office shall maintain confidentiality of all case records, third-party records, court records, as well as any information gathered in the course of investigations and systems monitoring duties. These records are exempt from public inspection and copying under the PRA and shall be kept confidential, except as provided in B and C. So pretty much broad confidentiality of all records. But then in subsection B, in the course of carrying out the provisions of this chapter, if the advocate or the deputy advocate reasonably believes that the health, safety, or welfare of a child or a youth is at imminent risk, the advocate or deputy advocate may, not shall, may disclose relevant documents or information to any of the individual entities listed in an existing subdivision of law, and that determinations of relevancy shall be made by the advocate. So there's already language in Title 33 about a certain group of people who information can be disclosed to. And so this is by cross-referencing this list, this bill does not create a new list of individuals. Instead, it's saying we're going to use this same list of people who it's okay to disclose information to. So just to give you sort of a sample of who is on this list, health and mental health care providers working directly with the child or family, educators working directly with the child or family, licensed or approved foster caregivers for the child, mandated reporters making a report in accordance with the provisions of this particular subchapter. Let's see. Other governmental entities for the purpose of child protection, a person, agency, or organization, including a multidisciplinary team authorized to diagnose, care for, treat, or supervise a child or family who is subject to a report or record of abuse. So those are the type of people who the advocate or deputy advocate could disclose information to under this list. And again, they can only disclose relevant documents, and it's the advocate who's determining if the documents are relevant for the purpose of this section.
So just inquiry here is, was this section, and there are other sections obviously that were probably reviewed by Judiciary Committee, as Representative Pahala and Noyes indicated. So they went through all this too. Okay.
Yeah, this section did spend some time in House Judiciary.
Yeah, I can see it.
Mhm.
All right.
And then next, so this is our second exception to the confidentiality rule. So the advocate or deputy advocate, again, may, not shall, may publicly disclose patterns of conduct or repeated incidents identified by the advocate or deputy advocate and carrying out the provisions of the chapter, if they reasonably believe that public disclosure is likely to mitigate a risk posed to the health, safety, and welfare of a child or youth, except that the advocate or deputy advocate shall not publicly disclose individually identifiable information about a child or youth unless the information is already known to the public. And second, they can't disclose investigation findings where there's a pending law enforcement investigation or prosecution. So in those situations, public disclosure about patterns wouldn't be allowed. Okay. So the next section is 3209, conflict of interest. Generally, this section says that the advocate and the advocate's employees, contractors, and members of the Oversight Commission can't have a conflict with the work that's being done by the office. Just want to pause for a minute. I know Senator Cummings had a question about how many employees, and you know, there is nothing that says that the advocate can hire employees. There's nothing that prevents them from doing that either. But the closest we get in this draft of the bill, at least, is that this mentions the advocate's employees, and you'll see that it's plural. It's not employee, meaning the one deputy. So this at least suggests that there could be other hires. And I think this, you know, at one point this bill was rewritten many, many times on the House side. At one time, there could have been more detailed language about hiring specific employees. And at some point or another, that language could have been removed. And this is sort of what was left over. But I just wanted to flag that for you since you had the question. So this section, the advocate's employees, contractors, and members of the Oversight Commission shall not have any conflict of interest with the department or any entity that provides services to children, youths, and families through funds provided by the department relating to the performance of their responsibilities. And for the purpose of this section, a conflict of interest exists when any of the following occur. So if an employee or a contractor has direct involvement in the licensing, certification, or accreditation of a provider or facility delivering services, if an employee or contractor has a direct ownership interest in a provider or facility providing services, is employed by or participates in the management of a provider or facility delivering services. And lastly, if an employee or contractor receives or has the right to receive directly or indirectly remuneration for under a compensation arrangement with a provider or facility delivering services to children. So that's the conflict of interest. And then we move into 3210, which is the Oversight Commission. I've already talked a lot about this group. This is kind of the steering committee that gets to do the appointments or make recommendations for the governor's appointment. So we have that this group is created to provide guidance and recommendations to the office. The membership, the commission is to be composed of the following members who shall not have a conflict of interest with DCF. So first, one member of the House who serves on Human Services, who shall be appointed by the Speaker. One member of the Senate who serves on this committee, who shall be appointed by the Committee on Committees. a member with professional expertise in childhood trauma, adverse childhood experiences, or child welfare, who is to be appointed by the governor, the executive director of racial equity, and then 5, 6, and 7 are each a member of a child advocacy group, board, or commission, one appointed by the speaker, one appointed by the committee on committees, and one appointed by the governor. In subdivision 8, an adult who was in the custody of DCF within the past 5 years, who shall be appointed by the Vermont Foster and Adoptive Family Association. And lastly, a relative caregiver of a child or youth involved in the child protection system, who is appointed by Vermont Canada's parents. The commission has 2 responsibilities: to recommend qualified applicants to the position for the position of advocate to the governor, and secondly, providing oversight of the office and its efforts to support an equitable, comprehensive, and coordinated system of services and programs for children, youth, and families. And then this group has the administrative assistance of the Agency of Administration. That's in part because this group gets to work before an advocate office is even created. They have to make that first recommendation for the advocate before the office is up and running, and they need some support to organize. Then we have some language about
Katie,
yes.
sorry to interrupt.
No, that's okay.
I have several questions for when you're done, but one that's specific to what you just went over. When you're listing the members of this commission, I think it's a commission. Number 9, the relative caregiver. Does that mean a caregiver who is a relative of a child or youth?
Yes.
Okay, the phrasing is a little weird because there are 2 different meanings of the term.
Yeah, I hear what you're saying. Okay.
So I was like,
Thank you for
relative.
flagging that. Yeah, so we could swap that. The caregiver who is a relative of.
Yeah, I think it just might be more clear.
Okay, got it. Thank you. Okay, so we were in subsection E, meetings. We have that the member from Human Services is calling the first meeting by August 1st. Again, this assumes that this piece of legislation starts on July 1 or is enacted July 1. Let's see. Then they're selecting a chair from its members at the first meeting. And then we have language about a majority constituting a quorum. And then we have language about compensation and reimbursement that is fairly standard. But you'll note that it's for 4 meetings annually, no more than 4 meetings annually.
And that's up to 5 or 6 years.
This group doesn't.
Oh, no, this one keeps going.
This one keeps going. Yeah.
This keeps going.
It's the
Okay.
advisory council that
Yep.
sunsets.
Yep.
So that is it for the new chapter, creating the office of the Child, Youth, and Family Advocate. And so now we're transitioning. So in section 2, we're adding to the list of mandated reporters, the advocate. That's subdivision 13. A mandated reporter is any employee of the office of the advocate. So
wait, let's well, we'll come back to that. I think there are going to be a lot of questions, but any employee is an interesting. Okay. I'm my brain is going, so that's good. Keep going.
Okay. And then in section 3, actually we'll see it in section 3 and 4. So there's existing language and statute that requires DCF to provide records created with regard to reports of abuse and neglect to certain parties. And so this section adds the office to those list of parties. So the lead-in language, upon request, the department records created under this subchapter, meaning records about abuse and neglect, shall be disclosed to, And then the new language, the Office of the Child, Youth, and Family Advocate, for the purpose of carrying out their job in Chapter 32. So what this is almost doing is cross-referencing without an actual cross-reference what authority is already given to the office itself. So the new chapter that's being created, the Office of the Child Advocate, already says DCF, if we ask for this information and it's a reasonable request, you have to give us these documents. What this section 3 is doing is saying, DCF, you already have permission to give documents to these entities, and we're adding the Office of the Child, Youth, and Family Advocate to that list to be consistent with the new chapter that's being created in Chapter 32. And the same thing is happening in Section 4 with regard to juvenile judicial proceedings. Again, the lead-in language, inspection of such records and files by the following is not prohibited. And we're adding the Office of the Child, Youth, and Family Advocate there. Okay. So Section 5 is language that I already sort of hinted at when we were looking at the duties of the advocate, and saying that we were going to kind of have a time lapse to give the new office and the new advocate a chance to get their feet under them before all of the different duties and responsibilities would be applicable. So notwithstanding 3202B, which is where all the duties are listed, the advocate is only to assume responsibility for the duties listed in 1 and 2, which is what we went over, through June 30th of 2023. And that so this is a 6-month window, because this next sentence says that the advocate is to assume full responsibility beginning of all responsibilities beginning July 1, 2022. So the missing piece here that we'll see later on is that even though the effective date is July 1 on this, the advocate's first term doesn't begin till the following January 1. That gives time for the Oversight Commission to get organized, to make their recommendations to the governor, and for the governor to appoint an advocate. And then the advocate would begin January 1. From January 1 until June 30th, the advocate would only be responsible for the first 2 duties on the list of duties. And then beginning July 1, they would take on the full list that is in statute. Is that clear? I know that's.
No, that's good. I
Okay.
mean, yeah, just there's a window of time for organization, transition to a new program and everything. Yeah.
Exactly.
Getting their feet on the ground.
And here is this Section 6, which talks about the transition. So it's saying that the position is starting January 1, despite the fact that the effective date is July 1. There is an appropriation for this, and I might almost skip this for the time being and have Nolan cover all the fiscal pieces.
That's fine.
And then this Section 8, I am going to recommend that we actually take it out of the bill. This is repealing the Joint Legislative Child Protection Oversight Committee. I just took a look, and under current legislation, it's set to expire June 1st of 2022. So this June 1st. So this, in essence, if it took effect on July 1, would repeal something that has already sunset. So I think that this piece, it wouldn't have been that way last year, but because we're kind of spreading the work out over a 2-year biennium, this Section 8 should be removed.
Wait a minute. What you're telling me is if we had passed this bill last year, we wouldn't have had to do all that work over the summer and fall?
Well, if this piece was still in the bill, that would have been the case. Yeah.
Yeah. Okay. Yeah, that makes sense.
And then we have the effective date section. So we have the act itself taking effect July 1, but then all of the pieces in terms of like the work that is sorry, not the work, the ability for DCF to share certain pieces of information, that doesn't take effect until January 1. The appropriation doesn't take effect until January 1 because the office isn't up and running until January 1. Really-
What about the per diem and the reimbursement for the advisory committee? Is that in place?
Section 1 will be in place for that very reason, to give the Oversight Commission authority to start meeting and making its recommendations.
Okay.
Okay. Should I leave this up or take it down?
I think take it down for now. Wait, let's just ask.
Oh.
Whoops. Well, you can always put it back up, but I know that there are questions that the committee has, and I think we should hear. I'm sort of torn right now because I'd like to have the questions on the bill language itself and then go to Nolan and hear the fiscal information. Is that what is your thought, Nolan? Go ahead.
I actually think it might make sense for me to run through the fiscal note because a lot of the questions that have come up, I can answer.
Oh, good.
Some of the
Well, we
questions
like that.
So, and I'll make it quick and then they can ask questions and then Kate.
Yeah, okay, let's do that. And we'll questions on the fiscal note, we'll try to make second after we've had questions on the bill, after you've gone through everything. We'll sort it out. Not a big deal.
Okay. All right. Do you want me to go?
Yes, please.
Okay. For the record, Nolan Langwell, the Joint Fiscal Office. So there's two things posted on the website. One is a list of other advocate offices in other states. There are, I think, 27 or 28 listed. I think that's what Rep. Noyes was referring to. I would just say, I don't know if it's exhaustive. We can say that there's at least 27 states. There may have been more that I missed. I did this last year. So I think it's safe to say not that 27 states have doing it, but at least 27 states are doing it. And also what's useful about that document is it answers the question about where these different offices are housed. And you'll see that almost actually all of them except for one are housed within state government. I know that the committee had a whole conversation about how to do that. The other thing I'll just say on that is I looked it up. The Office of Racial Equity is actually in the Agency of Administration org chart. I don't know if it actually means it's under there, but they have Susanna Davis listed under the AOA. But last year when I was doing the fiscal note on this, I was talking a lot with the folks at the Vermont Ethics Commission. And I don't think that they're housed anywhere in particular, but they receive support from the AOA. And I know that there's language in the bill about that. So like when they need legal support or some admin support, they get it from the AOA. So just to help answer those questions. So I have a fiscal note. I can post it, or or if people want to look at it on. What would you prefer, Madam Chair?
Why don't you put it? Why don't you put it up, and we'll go through it together.
Okay, so
We have it. We do have it on our iPads. Okay,
I'll just share my screen real quick. All right. Do you see the fiscal note?
Yes, we do.
All right. So Section 1 establishes the Office of the Advocate. And so I looked at it had a full-time exempt position, as you've heard, who will be appointed. So you can see in here I have the cost, like a salary range of what it would cost for an advocate. I also include benefits, so that would be like your health insurance, your FICA, etc. I also include the cost of the deputy because the language in the bill says the office shall appoint, or that the advocate shall appoint a deputy advocate. So because there's a shall language in there, I put a cost for the deputy advocate. And then on top of that, there would be other administrative expenses, such as equipment and travel and other stuff that go into what normal work would be. And that would be as much, and then you add in space, because if it's state employees, there's the space costs. And so I build all that in. That all ranges between $10,000 and $20,000 on top of that. In terms of how many staff you would have, again, looking at the Vermont Ethics Commission, they have one FTE. I believe it's a 0.5 executive director and then a 0.5 somebody else. But then you could look at the new office that's being created, the health equity. And I believe there's one, maybe there'll be more later. So just give you a sense. When I did talk to the gentleman from the ethics committee, and they have a much smaller task, I believe. He said 0.5 was not enough. He was hammered. He was slammed, and he was overworked. So I'm paraphrasing and remembering from my conversations from last year. So when you think about how many people should it just be the deputy, you should hear more from other folks about estimated capacity of the work and the ability of the workforce to do that work. Let's see what else here. We also have the Oversight Commission, and I calculate per diems. And the per diems I estimated are about 3,000 annually for the per diems for that Oversight Commission. And then we have a council, and then you have 9 stakeholders and several legislators, and it's up to 12 meetings. And so I estimated that'd be about $13,000 annually. So if you go to the bottom of the page, you can see I have sort of the high-low range of all the different pieces that I've addressed. And then I have an annualized cost that would be anywhere between $200,000 and $300,000 annualized. There's a January 1, 2022 effective date. Obviously, that's passed, and that's, as Katie mentioned, you'd have to change that. But assuming you sort of go along the same path of a January 1 effective date, it would be a half-year cost in year 1 and then annualized. That's and then finally, there's an appropriation of 120,000. So that's where that came from, was sort of the middle of that range. What I'll say is that there was no appropriation for this bill last year because the bill hadn't passed into the Senate. So there was no need to appropriate money for it because the bill wasn't going to become law. Let me just see if I covered all the pieces that I wanted to cover.
Do you know, Nolan, is there any conversation over on, or maybe our House members know, any conversation about including this in the BAA, or not, probably not that, but the
It
budget?
wouldn't be, it's definitely not
In
a
the budget.
conversation in BAA.
Yeah.
And I would
no.
say that they haven't gotten the budget yet, so they're having their budget conversations. I think that when the budget comes, I would suspect, or that the House members would probably, the Human Services Committee members, I imagine, would be reminding the House Appropriation members that this bill had passed. And that I imagine that once it comes back over from the Senate, it would have to be part of the budget context regardless.
Absolutely. Yeah, no, I'm just thinking about the timing for our work on this bill to make sure we don't get the horse in front of the cart too much.
Oh, let me unshare, sorry.
All right. So I think, I'm looking at it overall, you'd say, a ballpark figure of a maximum of $300,000.
Yeah, depending on how you choose to,
Yeah.
you may decide you'd only want 1 staff versus 2. It's all a matter of how you staff it. But
Right.
you would have to assume in, your basic benefit costs and obviously some admin.
Right. Okay, that's good. Thank you. Questions of clarification from Nolan? We're good. Okay, now let's open it up all the way. Questions for on the bill for Katie or for the House members who are still here. And I know, Ruth, you said you have some questions, so there you go.
Yes, thank you. Just looking at, I have a couple questions. Looking at the duties, is there a sort of investigatory duty for the child advocate? So if there's a complaint, like, for example, the Kern Hatton situation, they would have investigatory duties to investigate a complaint about child abuse or neglect or whatever. Yes, okay, I see nodding.
That's Subdivision B3 on page 2.
B3, okay. Oh, it says review, okay, and investigate those complaints. Okay, great, thank you. And I appreciate you saying it's not necessary to repeal something that will sunset, Katie. But I was happy to see that in there because it feels like we already have some committees and organizations and things in state government that do some of this work. And I was surprised to not see more either repeals of current things or moving duties around. So I know that not all of this is already done, and obviously that was necessitated the need or the desire for a bill, but some of it is already being done. So is there any change in duties of existing offices or agencies?
Not in this bill, no, not as drafted.
Oh, we'll hear testimony, I think, that will help answer the question. And Representative Noyes or Representative Pahala, do you want to respond to that question? I will just make a comment, Senator Hardy. The work of the Child Protection Oversight Committee was started when there was some pretty significant issues related to child death, and a need for oversight was identified, and that oversight has continued. And now, and as a result of that, things have maybe mellowed out a little bit and changed, but have not changed significantly enough that we don't need to have an advocate in place. And the point of that oversight committee being temporary was to do exactly what it has done, and that is to identify places where we need improvements. So,
Yes, Madam Chair, I wasn't
yeah.
questioning.
No, I'm just.
I would love to have my question answered though, by
But
one of the
we're
representatives
asking,
who worked on the bill.
we will. I mean, we're going to have folks come in and testify. I would
Kelly,
like
do
to
you
have
have anything
the
to add? 'Cause I would
two reps
love
to
to hear
add.
because it does seem like some of this is already being done. So was there a desire, any kind of conversation about getting rid of some?
Yes, there,
Yeah.
and Dan, feel free to add to this, but in testimony that we heard, I would say specifically from an independent from state government organization that looks at the child protection system, and hears a lot of complaints and tries to offer feedback. They were in favor of creating this office. They felt that even with all the work that they do, that feedback needs to come from somewhere that it will be actually taken into consideration and used to improve the system. And so that is testimony that we heard in our committee. And I would expect that you would hear testimony from people who are already doing this work outside of state government as well as a part of your work. And Dan, if you have anything to add.
Yeah, I think, and that's where we really put access to information. That's why it had to be kind of within state government, so that they could have access to the confidential information from DCF or Department of Health or across state government, so that they could draw some conclusions about how best to solve these problems and help people.
Yeah, I guess my question was
That
more,
answers your question.
it does not. My question
Ask it again,
was more
please.
that DCF probably already has some of these duties within their list of duties. And did you look at saying, well, if DCF is not the appropriate place for these duties because it's not working the way it is, and I understand clearly that it's not working, or in some people's opinions anyway, it's not working. Did you look at shifting some of the duties away from DCF to this new office?
We did not. We mostly just talked about what this office, how this office could help people, and we didn't talk about like digging into the roles and responsibility of DCF.
Okay, because the workload of this new committee, new office, and two committees is pretty high, and so I would have expected to see some shifting of duties from current state government entities, and also we have a number of committees that are actually in statute that already deal with some of these issues, and if they're not effectively doing this or are no longer needed, maybe we should look at getting rid of some of them. I did note from Nolan's list that other states that have similar things, they seem to be, the duties of a lot of them, or at least the names of them, are very different. Like it's just for foster kids, or it's just for specific populations, not broad like this one. And I also wondered, did this is similar to the Office of the Healthcare Advocate? Did you look at that language and duties as a model at all, Katie, or either of the representatives?
We actually, we talked to Mike Fisher at the Office of the Healthcare Advocate. I don't know if came in and testified, I can't remember, but I definitely talked to him on how that, as well as the long-term care ombudsman for nursing homes. I talked to them as well on how they were structured.
Mm-hmm. Okay.
The initial drafts of this were the language was pulled almost exactly from those two statutes, the advocate, the healthcare advocate, and the long-term care ombudsman. And there are many drafts in the House, so it's evolved quite a bit since that time. But the language was pulled almost word for word in some parts from that initially.
Mm-hmm. I just want to make sure that if we're setting up a new office, we set them up to succeed. And it seems to me that this office is going to need more resources than just a director and deputy to be able to do the long list of things. And if we're going to fully resource and give this the power that it seems that you all intended, that we need to look at who else is doing this stuff now and shifting resources and duties over to this office rather than doubling up on things.
One of the things that I heard Representative Noyes and Pahala say in the beginning is that it was going to be an office that would work collaboratively with DCF, judiciary, and others. So it may not be exactly replacing, and I'm just making this conjecture. It may not actually be replacing, but rather using the information to go across state government to get at issues. So we're going to have to understand that. It's an excellent question, and whether or not there are things that need to be eliminated or not is open. Certainly, we don't want to set up a situation where we have DCF doing exactly the same thing, yet we would want to have DCF informing the work of the advocate to take the burden and the pressure off of a social worker, for example, who can't do the full investigation. So I can see the balance beam being developed here. So we're going to have that conversation. Senator Cummings.
There it goes. I'm going to follow up with Senator Hardy. If we're going to do this, I want to make sure that we just don't set up a feel-good thing. You know, we've set up a child advocacy program and walk away. If we're going to do it, we need to do it well. My first question is, did the committee on child protection, is this formally a recommendation of that committee?
Yeah, we'll go through that recommendation. It was to look at this as a way to, yes. And
okay,
but also to know that we did take testimony, not just this year, but in previous years, including from the New Hampshire advocate. And we can do that. We need to get more testimony to make a determination as to what the final legislation looks like.
Okay, because I'm just trying, just on first reading, to think that two people can do this job adequately is fantasy. And also, because of some of my background, I've seen the damage that can be done to parents when investigations are not adequately done. when we talk right now, I believe DCF has the responsibility of investigating complaints of child abuse and making those assessments. When we talk about, and we talked about investigating Kern Hatton, is this group seen as somebody who is there to call the state to task when we missed Kern Hatton? Or are they there to do their own investigation? Are we going to get a complaint and have two investigators from different sections of state government show up? And are we setting up an adversarial relationship? I think we really need to be very specific about what we expect this two people, one person to do. I believe that aren't the healthcare advocate and the long-term care ombudsman housed outside of state government? Aren't they in legal aid?
Yep.
So this would be the
Yes.
first ombudsman we would actually bring in, whereas keeping an eye on state government is more the role of legal aid when it comes to poor people. Most wealthy people can hire lawyers and take the state on. So I think we need to think about housing it. And I think we really need to think about honing down the job, because this sounds like we're setting up another whole state agency. And I want to make sure that we do it right.
So thank you. Those are, again, they're excellent questions and things that we're going to have to hear in testimony to either reassure or suggest that it's too much. So, yeah. Any other questions for Katie? Was there a question in there, Senator? We need testimony is what I heard. Okay. Any other questions for Katie? All right. So why don't we continue on? I was going to suggest a short break before we went to the I'm actually going to suggest a short break. Let's take we have recommendations that have come to us from the Joint Legislative Child Protection Oversight Committee. I'd like for us to take a 10-minute break, and then we'll come back to this. And this will relate somewhat to the discussion we're having, but so we'll come back and have Katie go through it with us. Does that make sense to everybody? You okay with that? Let's do that.